Hello, I am Dr.Jyotish Patel, sickle cell expert from India. Today's topic is how to decrease prevalence of sickle cell in the community and how to achieve decrease in the population affected with sickle cell disease. The issue is it's a community problem and mainly in the rural or semi-urban areas. And if that is the area affected, challenge is how to diagnose and how to screen all population who is likely to have sickle cell. As far as India is concerned, India has got 70% population which is residing in villages. And those are the people who has got somewhat access to good health care, and maybe there are lacunae somewhere. All said and done, what is important is to get a specialized test done which are confirmatory, which are 100% specific and 100% sensitive. Having said that, whatever data which is available at present, possibly we need to introspect and find out that whether the prevalence which is mentioned or detected, is it a real value that we are looking for. Whatever estimates of prevalence so far we have, that the community which are affected with sickle hemoglobin, the prevalence rate is somewhere around 10 to 20%, even at times 30%. If we take average of 20%, then out of 140 CR population of India, if we consider 20% as the affected community with hemoglobin S, it will come to somewhere around 14 CR at 10%, and it will be 28 CR at 20%. If we consider 10% as the affected community, that is 14 crore population, and if we try to judge and estimate the prevalence at 20%, then it will come to 2.8 CR. So that is the likely population having hemoglobin S, either in form of sickle cell trait or sickle cell disease. The aim is to detect maximum numbers of affected population with sickle cell disease, because these are the symptomatic cases and who are prone to develop major complications and has got high morbidity and high mortality. In such a situation, that majority of symptomatic patients, they could be diagnosed when they reach to a treating doctor and they get the confirmatory test. And when I say confirmatory test, it has to be a good hemoglobin electrophoresis or HPLC, so that we don't miss a single case with sickle cell disease. Going further, that sickle cell trait individuals, we need to detect them too, because especially those who are unmarried or married and having sickle hemoglobin in form of sickle cell trait, these are the potential candidates who are likely to deliver affected sickle cell disease baby in future. Now, majority of the surveys, if that is being done by a screening test like solubility test, then there is a chance that we may miss out cases affected with sickle cell trait, because that is not the test which is 100% sensitive and 100% specific. Moreover, these are the tests which are being done in the community. And just to add on, now there is a point of care test which is being available, and that test also has got a limitation. So whatever data we have at the moment, possibly that does not reflect the true numbers of sickle cell trait and sickle cell disease in the community. So what is the way forward? I think the way forward is that we need to adopt a good technique and technology which should be available to each and every case with who undergoes test. For example, whosoever is sampled for testing of sickle hemoglobin should be tested only with the HPLC, so that we have got a true number of cases affected with sickle cell trait and sickle cell disease. Having said that, what is the advantage of this technique? That at least we are sure that what we are dealing with and whatever data we have is a perfect data. So patient gets, an individual gets a specific diagnosis, and we at our end we get the true information about the prevalence of sickle hemoglobin. If we do this thing, I think over a period of time, we'll have a total population which is being screened for sickle hemoglobin, and then we can go in for premarital counseling. Many times what is happening that those individuals who come for premarital counseling, if it is based only on say solubility test, if it is negative, do not believe that this is 100% true. Unless HPLC is being done, marriage counseling is difficult. Going further, in fact, there are chances that there are other haemoglobinopathies like thalassemia tree and at times hemoglobin D Punjab or hemoglobin E thalassemia. These are the carriers which are also coexisting in the community. So, missing one sickle cell diagnosis and missing another diagnosis of beta thalassemia or hemoglobin D Punjab or hemoglobin E thalassemia could be a major threat, because then there is a chance that you can have affected child with a combination double heterozygote in the form of sickle beta thalassemia or sickle hemoglobin D Punjab or even sickle hemoglobin E thalassemia. So, my point of concern is to decrease the burden of sickle hemoglobin. What is most important is the technology that we used in the surveys, and I think this is going to be a very, very important decisive factor for those who are healthcare provider and the healthcare planners, because it is always looked upon with the cost effectiveness of the technology which is adopted for the surveys. But at the same time, apart from the cost effectiveness, what is most important is missing a right technology at the right time would result into what? Will be lagging behind our targets of detecting hemoglobin S population, affected population in the community. So, as far as my suggestion and submission is concerned, the best thing is do HPLC testing of the community and at least avoid doing screening test in the form of solubility or the point of care test. If we do this thing, in 1 or 2 years time, we'll have a exact number of sickle cell trait, sickle cell disease, or other hemoglobinopathies and normal population in the community, and then we can have a future strategic planning how to minimize birth of sickle cell disease affected child and go forward for the better management of sickle cell hemoglobinopathy. And not only that, whatever we are targeting by 2047 about eradicating hemoglobin S from the India, I think that target we can achieve if we adopt this methodology at present time. Thank you very much for patient listening. Anything that you have as a query, you can put a remark or a comment on the box and let me know if you have got any query. I can answer to it. Thank you so much.